Hello, I'm Aliana, and I'm gonna be your nurse today, and I need to perform head-to-toe assessment. Is that okay with you?
Yes, ma'am.
Can you say your first name and last name?
My name is Glenn Jacob Filomeno.
Okay, and your birth date?
March 7, 1999.
Okay, do you want me to call you Glenn or Sir Filomeno?
Glenn will be fine.
Okay, Glenn, can you tell me where you're at?
I'm in hospital.
Okay, and can you tell me what you're doing here today?
We're gonna be performing head-to-toe assessment.
Okay. We said that all correctly, and he's alert and oriented 4 times. So we can chart that he's alert 4 times. Okay. Are you having any pain on a scale 0, no pain at all, and 10, the worst pain you ever experienced right now?
0 means no pain at all.
So what we're gonna do is to test the cranial nerve number 7, which is the facial nerve. So, Glenn, can you please close your eyes, close tightly, and open them up. And now smile, frown, and pop up your cheeks. So, you can do that with ease. So, this cranial nerve is intact and functional. Now, we're gonna palpate his head and see for any mass indentation or skin breakouts. So, let's look at his hair. Also, check the back of his hair. While doing that, let's look inside his hair to see infestations like lice or skin breakdowns. So, I can see none, so it's normal. So now, we're gonna feel his temporal artery. Here and here. That's nice. So right now, we're gonna test the cranial nerve number 5, which is the trigeminal nerve. Okay, Glenn, can you please clench your teeth? Okay, right now we're gonna feel his masseter muscle right here, and his temporal muscle right here. And right now, please open your mouth against your system. Okay, you can do that also. So right now, we're gonna feel his temporal mandibular joint. Open, close, open, close. So I can hear no clicking sound, so it's normal. So right now, please tell me if you feel any pain. Max left maxillary,
No, ma'am.
frontal,
No, ma'am.
Now, what I'm gonna do is perform the eye assessment. I'm gonna inspect the eye and check first the eyelid if there's no redness. Okay, this eyelid is pink, so it's nice, and the scaly rock is white and shiny, and the pupil, the iris, and conjunctiva is normal. Now I'm gonna check his eye to see any abnormalities like strabismus, which is the eye is closing and there is no swelling, redness, and jaundice. So it's all normal. Now I'm gonna test different kind of tests, and the first test is the 6 cardinal field of gaze. Okay, Glenn, what I'm gonna do is try not to move your head and just follow where I move this pen. I'm looking for involuntary shaking of his pupil and how reacting of his pupil. Okay, you can do that. Now I'm gonna check his accommodation. Again, just follow this pen. Okay, you can do that also. Now I'm gonna document that his pupils are equal round and there's no sign of abnormalities and is reactive to light and accommodate. Now what I'm gonna do is to perform the ear assessment. First, I'm gonna inspect his ear to look for any masses, lesions, drainage, or any tenderness. Right now, what are you feeling? Do you feel any pain?
No, ma'am.
Right now, I'm gonna palpate his ear. cranial nerve number 8, which is the vestibulocochlear. Now I'm gonna occlude this part of his ear and check if he could repeat what I'm gonna whisper.
Hot and cold.
The other side.
Sweet and spicy.
Okay, there you go. So he could repeat the 2 words that I've just whispered. So this cranial nerve is intact. Now what I'm gonna do is perform the nose assessment. First, I'm gonna make sure if his nose is in the midline of his face, which is yes. And now I'm gonna check of his septum, if it is deviated or not. So it is not. And Ken, are you having any trouble with your nose?
No, ma'am.
Okay. Now I'm gonna test the patency of his nose. Ken, I want you to do is to occlude one of your nostril and breathe out to the other side. Okay, and to the other side. Okay, so I heard airflow both sides, so it's nice. Now I'm gonna check inside of his nose and look for any drainage, swelling, redness, or any abnormalities. So it's clear. I see none, so it's all normal. Now I'm gonna test his cranial nerve number 1, which is the olfactory nerve. Ken, I want you to close your eyes, and I'm gonna put something in front of your nose, and what you're gonna do is to smell and tell me what you smell.
Vanilla.
Okay, indeed it is a vanilla blast, so his cranial nerve number 1 is fully functional. Now I'm gonna be assessing his mouth. First is to make sure that you wear gloves, and if your patient is coughing, you should wear a face mask so you don't get any mucus on your face. Now I'm gonna inspect his lips if it is nice pink and it is not chapped and no sores. So it is all normal. Now I'm gonna test the cranial nerve number 12, which is the hypoglossal. Again, can you please tuck out your tongue and move side to side? Okay, you can do that with such ease. Now I'm gonna inspect inside his mouth and look for any sores and swelling. So open your mouth. I'm gonna check the side of his cheeks so there's no sores, and to the other side as well. Now stuck out your tongue, and it should be moist and pink. So it's moist and pink and not dry, so it's all normal. Now I'm gonna test the cranial nerve number 9, which is the glossopharyngeal, by letting the patient open his mouth and say ah. So open your mouth and say ah. So I'm gonna check if the ovula is moved up. So this ovula is moved up, so it's all normal. Now I'm gonna check his gag reflex. Open your mouth. So we can do that. And obviously, his cranial nerve number 10, which is the biggest, is fully functional because he can talk without hoarseness.
trachea. And his nice feeling is 2 plus. And we're just going to feel on the other side. And same strength, 2 plus. Then lastly, what we want to do is we're going to auscultate the bottom part.
Okay.
Wow.
Now let's move to the upper extremity. So what we're going to